Good to have you going down the road with us. We got a lot of people lined up for you today. On Friday, well, late Friday, no, it was Saturday. The governor came out and he said, you know what, we're going to have a mask mandate. We're going to make sure we have a mandate, and there's going to be a fine involved with it. In fact, he empowered the local law enforcement to utilize a part of the Century Code that empowers them to go up to $1,000 fine. So Governor Burgum quite serious about it. He sent that message out. Of course, now that burden falls upon law enforcement in how you're going to go about enforcing it, who you're going to fine, how you decide you're going to fine, or whether or not you fine, period. We've got with us right now the sheriff of the largest law enforcement agency in North Dakota, and that is Sheriff Jesse Johnner with Cass County. Sheriff, good to have you coming down the road with us.
Thanks, Joel. Thanks for getting me on. I always appreciate the opportunity to get information out to our citizens.
Did the governor talk to you and your department and every department prior to making this announcement?
I did not talk to the governor specifically. I'm not sure if he had reached out to other agencies or not, I guess, but I had not talked to him specifically.
Okay, so that burden now is left to you. And your deputies to go about making sure people adhere to it. What's your game plan, Sheriff Johnner? What now that the ball's in your court, where do you take it from here?
Sure. Well, again, Joel, thanks for getting me on. Thanks for asking me that question. So it's always going to be the goal of the Cass County Sheriff's Office to provide public safety to our citizens. And as you know, public safety encompasses a lot of different aspects. As the sheriff of Cass County, I've always taken an approach, no matter if it's a new ordinance that's been implemented, a new law, or in this instance, a governor's order, to always take an educational approach first. That's always going to be the objective. We've had a few of these orders come out since this pandemic has started. Some of them have been a little bit different. So education is always going to be the first approach by the Cass County Sheriff's Office. And what I mean by that is if we get called to a situation where someone feels like these orders might not be followed, we're going to respond and check into it and see exactly what it is that's going on. As a law enforcement agency, I feel like it's our duty to respond to all calls for service and investigate them and see how we can assist in any situation. Now, again, education is going to be the primary focus. We're certainly not going to have our deputies out driving around looking for these types of violations. And the reason that is because we're busy, Joel. Like you said, we're a large agency. We've got a large jail. I've got several people that are out on quarantine right now because through exposures. And so we're having to pull some of our field staff in to help in the jail to keep the doors open. We take a lot of calls for service every year. So, we got to prioritize things much like anyone at any job has to do to get through their day and be efficient and effective in their enforcement efforts.
So you get a call. You get a call from someone in, not to spell it out, but I'm going to use a town for an example. Okay, you get a call from Page, North Dakota. That's in your jurisdiction, and the folks in Page said, look, the local pub is not adhering to this size limit. Nobody in there is wearing a mask. How do you as a sheriff's department deal with a call like that?
Well, obviously, if someone has a concern, and it would be a public safety issue in my opinion, we don't know exactly what's going on there. We have a complainant who's called in, and they've got some information, and they think that there could be someone who could be, that there could be a public safety issue at risk. So we're certainly going to send deputies out and look into that situation. If we got there and the governor's order was being, not being followed, we would simply just have a conversation with that bar owner. I think you said the bar, probably.
Yeah.
We would just have a conversation with the bar owner, and we would work together with them to come up with a good plan going forward so that it didn't happen again. We don't want businesses to fail as well. I mean, no one does. This has been a hard time for everyone, and so we would work with them. We would provide the education and try to rectify that particular situation that we are working with, the original call for service, and then we would go about our business.
But you as sheriff of Cass County, someone who has just a huge jurisdiction, and quite frankly, you're the most populous state in all of North Dakota. You in Cass County, as the sheriff, are not making any statement to the public or to the citizens of Cass County that you won't do something, that you're ignoring the governor's executive order.
No, because Joel, for number one, like I mentioned earlier, we're a law enforcement agency, and when people call in and they want something to be looked into, it doesn't matter what it is. If it's something that falls under our wheelhouse and something that we would look into, in this instance, it's public safety. We're always going to go and check on it. I mean, that's what we're here for. And so we would simply just go there and investigate what the calls for service was, what the complaint was. It would be tough for me. I'm not the type of person that's going to sit at my desk and say that we're not going to do this, that, or the other unless it's something that we wouldn't normally do. Like I said, we have a duty to respond to calls for service and check into information that's being relayed to us. Now, once we get there and how we handle it, we're going to use common sense and we're going to use discretion, Joel, because I think that goes a long ways, right? And sometimes people just need the education because maybe they don't know everything, but we're certainly not going to be heavy-handed in this. But we also want to make sure that, we realize that a lot of people have been affected by COVID-19. And my main objective, and I think that we'll have this because we haven't had any issues, is that the citizens of Cass County will do their best to make sure that everyone's safe and they'll help us. And we'll work together with them to make sure that people are safe. I've never really had an issue with people not wanting to help us or abide by different things if they can help us.
See, to me, that makes the most sense. You're sitting there as a sheriff's department. You come out to Leonard, Page, any one of those communities, and you say, look, you're not adhering to what the governor put in place. We have had a call, and because we had that call, we had to come out and check it out. Now, here's where you need to be. That's going to get their attention. Any place, any restaurant, any bar, any place where people are receiving service. I pulled up to the gas station that I usually go to where there hasn't been, it's been pretty cavalier in terms of people wearing masks. I walk into that gas station wearing a mask and you would think that I'm just like the you can about imagine. People look at me and just shake their head like, why are you wearing that mask? Now, because the governor put this in place, there's a great big sign out in front of the door that says mask required. And when I walked in this morning, everybody was wearing a mask. So, if you had showed up there and they hadn't pushed that, they would have put that sign out. And so deterrent versus fine, I just think it's wise, Sheriff Johnner, that you don't give it away. Because that second, that third visit, when they won't adhere to it, when they won't listen to you, you need to have that tool in your toolbox. And so it just seems to me that to do your job, common sense, yes, but making sure you don't give away that tool in your toolbox has to be pretty important.
Definitely. And one of the things that you mentioned, we get into a lot of different situations, which is why we would want to go to the scene, Joel, and check on these things. Because now, you've made reference to a business, but there could be instances, obviously, as you know, where someone goes into a business and the business had asked people to put on masks and those people refuse, and then they call us for assistance. And of course, that's a little bit of a different issue because the business certainly has the right, because it's their property, it's their business to ask people to do different things. And if the people don't comply, they can ask them to leave because it's their business. And then of course, in that type of situation, we would probably be called to assist with that. But again, the whole idea behind this is really, I think everyone wants the same thing. We don't want people to get sick. I know that people are concerned about, their rights and the constitutionality of this. I'm the sheriff of Cass County. My main objective is to hold the Constitution of the state of North Dakota and the Constitution of the United States, and I'll do that. That's what I swore an oath to do. The law that the governor pointed out, it's actually a law. This isn't something that's just made up. He can do it under state statute 37-17-1- subsection 5. So this is a law that he put into place, and so we're gonna, we're not out there. We're not going to be heavy-handed with this thing. We really just want to We want people to comply. We want people to be safe. We want to try to get a handle on this disease, or this virus, excuse me. And so we're just going to do our best to provide public safety and education and try to help people through this time. We're not going to run out there and we're not going to be citing everyone. But, you know, if we did have something that was really egregious, we might have to approach that a little bit differently.
Mm-hmm. See, to me, that's exactly what Governor Burgum would want, or at least that's the tone he wants set. But that isn't the tone that's being set by Stark County Sheriff Corey Lee. That isn't the tone that's being set by Bowman County Sheriff Frank Erbley, and that isn't the tone that's being set by Hettinger County Sheriff Sarah Warner. It goes back to, and I don't mean to involve you in this. It's not your job to criticize these individuals. I know law enforcement has to stick together, but in the 40 seconds I have left, I mean, they gave away that tool in that toolbox. So it doesn't make any sense to me, especially when there's light at the end of the tunnel, when we're so close to where Dr. Fauci and others saying that we have a vaccine. Sheriff, closing comments? You got 20 seconds. Go get them.
Sure. So again, Joe, I appreciate you getting on here, and I just really want to assure the citizens of Cass County, or ask them for their assistance in this. I by no means don't think that people aren't going to do their best to try to follow these orders. And so if people have questions, they can certainly call us on some of the orders that were put out. And we'll just be out there working with our citizens to make sure that everyone's safe, and you know, try to do your best to help us, and we look forward to that.
Thank you, Sheriff Johnner. When we come back, Dr. Grant Severson's going to join us. He's a pediatrician. He understands what's going on with much of our kids that you see going to school, but he's got some strong opinions of what needs to happen. And so let's talk to the doctor right after this.
Howdy, folks. It's a Line Cafe. I reckon it's time you're due for a hearty meal. So saddle up for the day with one of our Hey Bossin' breakfast homemade soups. Fill your grill at a salad bar. Sink your teeth into our famous Line burger and barbecue ribs. Top it off with spur rattling pie with a calm roll that's sure to put a smile on even the toughest outlaws. Shake the dirt off the boots each night and warm up with the gang. Tell them about it, Stacy.
I can't wait to see you at the County Line.
Capital City Restaurant Supply is your one-stop shop for quality restaurant products for the large to small kitchens. Commercial-grade restaurant and bar supplies, limb game processing equipment, refrigeration, dinnerware, and smallware. We sell everything including the kitchen sink from trusted manufacturers for the chef and all of us. Open to the public since 1971, we are veteran-owned and North Dakota proud. Let us take care of your restaurant and home kitchen needs today by visiting us at 1414 Interstate Loop in Bismarck or on the web at capitalcityrestaurantsupply.com.
Beck Communications is honored to be recently recognized with 3 Broadband Now awards. Beck Communications Cooperative was awarded in the categories of Top Internet Speeds Nationwide, Top 3 Fastest Internet Providers in North Dakota, and North Dakota's #1 fastest fiber provider. It's only through the support of our members and customers that Beck Fiber delivers award-winning speeds and service. Thank you, Beck Communications Cooperative members and customers, for your years of continued support.
Introducing Accord Comfort Sleep Systems, a better way to sleep. We offer you 5 different models to give you the perfect choice of support and body comfort. Every model begins with our exclusive Accord Comfort Reflex Layer. This ensures proper spinal alignment and a deep down body relief. Our 8-inch Whisper Breeze provides a medium firm feel, and our 10-inch Gentle Night model has a quilted top, giving you a medium plush comfort. Both use Outlast fabric on the top of your mattress, ensuring that your body temperature is not too hot and not too cold. Our Copper Rest Sleep Series is our premier mattress, offering your choice of firm, plush, and luxury plush. Every model uses copper-infused gel latex and provides all the health benefits of copper. Accord Comfort mattresses are handcrafted in the USA and come with a 60-night sleep guarantee. You're going to love sleeping with us. Order today exclusively at accordsleep.com or Tom's Home Furnishings in beautiful downtown Harvey.
Is your business phone system outdated and expensive to maintain? Most large VoIP companies leave you on hold or struggling through online support and training for your employees. With Beck Connect, you always have fast, friendly, local support. Familiar faces with the know-how to keep you connected. Take advantage of the newest technology in voice calling, video conferencing, and virtual meeting rooms. Beck Connect gives you all the features you need with no upfront investment and no obsolete hardware or software ever again. Simplify your communications. Choose local. Choose Beck Connect.
Welcome back to Down the Road. The person I'm going to bring in now is Dr. Grant Severson. Dr. Severson is a pediatric rheumatologist. If I'm saying that wrong, Doc, I know you're a doctor. I hope I pronounced this right, but I wanted to talk to him with a doctor's perspective on what the governor just issued and the importance of wearing a mask. Doctor, good to have you in.
Yeah, thank you for having me.
Let's talk a little bit about what the governor said, because there's a lot of people who are out there saying, look, my doctor said it's not that important, or it's not that big a deal, or, hey, you're going to be just fine. You're young, you're healthy. Of course, you deal with young people. Tell people what your attitude is when it comes to wearing a mask in COVID.
Yeah, I think a lot of this, the issue with COVID is that our understanding of what's been going on has evolved over time. Certainly in the beginning, it didn't seem like, maybe it would impact the United States as much, or even North Dakota as much. It seemed to be something on the coast. But like any infectious disease, and, we learn things the more we understand it and study it. And, certainly the messaging has been inconsistent from a federal level, and which has made things even more difficult. I think what we have learned is that wearing a mask not only protects you, but it can also, the biggest thing it protects other people. And we have to look at this as it's not about you, it's about protecting your grandpa and grandma, it's about protecting your friend down the street, it's about protecting the service worker at the grocery store. And it's ultimately what has happened is, as the virus has continued to spread, it's started to really start to stress our healthcare system. And right now, what we're experiencing is our hospitals are getting full, and even routine things such as normal surgeries, or if you even need like a scheduled bypass surgery or things like that, they're having to be pushed back. And what's going to happen is you're just going to be a cumulative effect on the healthcare system, where not only you're at bad outcomes because of COVID, but also because people can't get the routine healthcare things they need to get done.
So on Friday on my radio show, I had the president of Essentia on and the president of Sanford on. Now, these are competing hospitals in Fargo, and both of them said the same thing, that they're getting overwhelmed, that they don't have the space for everybody, that North Dakota's rank as the highest in the nation per capita is something that we don't and can't deal with. They were pretty strong about it. I asked them whether or not there should be a mandate for mask wearing, and the president of Essentia Hospital said absolutely there should be a mandate for mask wearing. And then that Friday night, the governor, after the football championship was done with North Dakota State high school activities, he issued that mandate. So, do you believe, and I have to ask you this, do you believe that law enforcement and others should take shucks, we sure hope you adhere to this, or do you think they're going to have to get up in people's grill a little bit and say, wait, the governor said this and he said it for a reason. You got to get this done. What would you as a physician recommend?
Well, I think we all have to take this very seriously. This is not going to go away unless we all come together. And if we don't have greater than 90%, 95 or 99% compliance with wearing masks and social distancing and washing our hands, the pandemic is just going to continue to get worse until we have an effective vaccination in place. And I think what people are struggling to realize is that this is going to keep happening for the next year, plus if we don't have an effective vaccine, or if we're not coming together and controlling this with the public health measures that we can use. And this has proven to be effective in other countries. I mean, you can just look at the province of Manitoba, north of us, I mean, they are, how many, I don't know how much bigger they are than North Dakota, but they have, far fewer less infections overall and, hundreds of less deaths. And you look at other states, even Vermont has, more people than North Dakota. And I think last time I checked, they had less than 70 deaths from COVID compared to North Dakota. And so if you do take these things seriously, they are effective. I think for law enforcement, it is a struggle because you don't want to make this something where it's super contentious. But at this point, the amount of information that's gone out there that's so confusing to people is if you're not consistent from a business to business standpoint, people are going to pick and choose, and they're going to be frustrated because not everybody's going to be applied to the same standard. And so I certainly, yeah.
Oh, I'm sorry, Doc, but in the couple of minutes that we have left, you understand children and what's happening to kids. Just talk to me about what they're going through at a time like this.
Yeah, I think for what I see with my own children and with my patients is, for the most part, kids are very resilient. And we're asking them to do things that we're not applying to ourselves as adults. We're having adults going out to bars and restaurants and not masking and going to parties where we're asking our kids to go to school and wear a mask all day long, be consistent, and be compliant. And it's stressful. It's stressful for them. It's a cumulative effect of this back and forth in and out of school. It's stressful for their teachers and their parents. And, I think if we don't work together and show our kids how to behave and be civil to one another, it's just going to, be a long-term impact for them.
Dr. Fauci came out and said we could be vaccinating people as early as December, or at least the end of December. So to me, that's light at the end of the tunnel. That's what everybody's been looking for. And of course, it's those individuals that it's essential that they get that vaccine, that they get vaccinated, which means to me the elderly, healthcare workers, emergency response. I mean, we can all common sense wise look at those. It also means to me that kids who are less vulnerable to this might be last. And so I'm curious what you think about that.
Gosh, that's a really difficult question. I mean, I certainly think that you want to make sure the vaccine is vetted, and we want to make sure that what we're giving to our healthcare workers and our kids is safe. And I certainly think that you need to start with the most vulnerable populations, and I think that is healthcare workers and our elderly. And I think as long as we get the right people vaccinated early, I think that it'll help protect our kids in the long term.
Well, it's honest. I mean, you were just honest. Dr. Severson, good to have you on. We'll do it again sometime.
Thank you very much.
When we come back, Rick Becker is going to join us. He's a state representative and a physician himself. He said he's not going to wear one. He said he's not going to adhere to what the governor has said you need to do. Let's ask him why right after this.
I just went in for a regular mammogram and I found out that I had a little tumor.
Through the exam and the biopsy, it was determined that I had cancer.
I got a call from one of my doctors that I was diagnosed with breast cancer.
After 5 years, they found a local reoccurrence.
The first thing you hear when you're told you have a cancer, it's a little daunting because you don't know where to go with it.
Since 1999, in a partnership between CHI St. Alexius Health and Sanford Health Bismarck, the Bismarck Cancer Center has provided the most advanced radiation therapies and holistic support services for cancer patients and their loved ones for 20 years.
I've been at the Bismarck Cancer Center since it started. I actually was in the basement of Med Center 1 before, when we had old machines and old equipment. And thankfully, the two hospitals at the time, St. Alexius and Med Center 1, joined forces to create the Bismarck Cancer Center.
I walk in the door, I get nothing but hugs, and I was marveled at them. I mean, I thought it was the best place in the world.
The staff is unbelievably compassionate, and they explain everything to you.
Everybody's genuinely concerned about your well-being, and the level of care is just top-notch. The Cancer Center just does such an amazing job of helping people.
To me and my family, the Cancer Center means life. It's given me the ability to live out my life with my family, my wife, my children, my grandchildren.
Because of them, I'm 2 years out, get to move on with my life, make a difference now for other people.
I would recommend this center because the minute you walk through that door, they've got your back.
This center means so much to me and to the people that are in this building, and we just want to keep giving it back to the community and providing for them what they need.
I'm Katie. I've been cancer-free for 2 years.
I'm Steve, and I've been cancer-free for 4 years.
I've been cancer-free for 10 years.
10 years.
11 years.
15 years.
My name is Lainey, and I've been cancer-free for 18 years.
Bismarck Cancer Center, your partner against cancer for 20 years.
Who do you trust with your digital life? Not all cloud backup providers keep your data truly private. Beck Cloud Backup uses advanced multi-layer encryption to keep your family photos, videos, and sensitive business documents secure and only for your eyes. Your Beck Lightband Internet service already includes 50 gigs of free storage to keep your digital life safe and secure. Call us at 701-475-2361 to start using your Beck Cloud Backup today.
Welcome back to Down the Road. I've got, this gentleman has been so much fun to interview because our politics are so incredibly different, but he just gives you honest answers. So I've got the opportunity now to visit with another individual that you hear or see on this network all the time, and that is State Representative Rick Becker. Representative, good to have you on.
Thanks, Joel. Happy to be on.
All right. I want to give people a little that are listening during this time slot and might get to know you for the first time. I want people to know what you do. Tell them what you do for a living.
I'm a plastic surgeon. I've been in Bismarck a plastic surgeon for 23 years now, and then I'm also a bar owner. I used to be a restaurant owner until the governor closed us in March and we couldn't handle it anymore, but still own a couple bars.
Okay. So entrepreneur, physician, got that word doctor in front of your name. So big background. And the one thing I would add is a state representative, which means you're in one of those chairs when laws are being made and you can vote for or against. I want to talk to you a little bit about what the governor did. The governor issued that mandate and said you will wear a mask. As per this section of the Century Code, you could get up to $1,000 fine if you don't adhere to that. Many people called for it. On Friday's radio show, the president of Essentia and the president of Sanford both said that they're getting overwhelmed, that North Dakota's numbers need to be brought under control. It's my understanding that you said you're not going to adhere to wearing the mask. Is that true? And if it is true, why?
That is true. First, I'll say I agree. There's a significant concern with the hospitals. And we do need to figure out what we can do to mitigate the concern, to open up beds, to expand bed capacity, and so forth. So I'm not contesting that at all with that concern. As far as not wearing a mask, I think that mask wearing should be done with some logic. And if a person is asymptomatic, it is highly unlikely that they're going to transmit the disease. And it's for that reason alone. Now, in whatever capacity I am, whether it's in clinic or wherever, if someone requests me to put on a mask, I'm happy to do it. And we have a sign up at the front of the clinic. If you'd like us to wear a mask, please just say the word. We're happy to do it. If I want to go shopping, I don't gripe about it if I'm going into a store that requires a mask. I'll put on a mask. But I will, and I do, if at all possible, go to stores that don't require masks. So the logic isn't there.
So, Representative, you're a business owner. As per what the governor said, you could subject yourself to a $1,000 fine. I'm not saying that the the police chief in Bismarck is going to come and say, Rick, write the bottom of this ticket because you just got one. They're probably going to warn you. They're going to warn you, and then they're going to get you. So, if your business isn't ready to adhere to that, for that matter, your clinic, if they're not willing to adhere to what the governor put down, Are you ready to pay the fine?
Well, I guess I wouldn't have a choice. So yeah, I mean, my personal choice in this matter is more important to me than a possible fine.
Okay. So that being said, you're walking in and doing surgery on someone. I could say this, that, or whatever. It doesn't matter. Everybody's got an image of what plastic surgery is. So you're going to walk in and do that surgery as a physician. Would you ever do it without wearing a mask?
No.
Okay. Then it begs this question. What potential risk are you? As I know you're you're somebody who's going to wash his hands. You're somebody who's never going to do a surgery if you feel down at all. I mean, I know you that way. So what potential risk, if you didn't wear that mask, would that patient have of being infected because of you?
A much higher risk.
Okay. Why? I mean, you're sitting there wearing gloves. You're doing all these things, Doc. And I mean, why would they have a higher risk why would they have a higher risk than what they'd have if they ran into you and you were sneezed or coughed on them?
Because our mouth is full of bacteria, okay? But I don't wear a mask when you and I are in close proximity for fear that the bacteria in my mouth is going to cause an infection in you. It's not going to happen. When you have an open wound and you're leaning over looking at that wound, naturally there's going to be tiny particulate aerosol that's going to come from the mouth, which would have bacteria in it. So that prevents that from going to the patient. This is entirely different than what we're talking about with COVID, because if you are symptomatic, you are going to have a viral load enough that the virus is going to be all over in your mouth and your saliva, and it will be aerosolized as well. If you're symptomatic, I want people to wear masks. Absolutely. There's no doubt about it, because when you're coughing and sneezing, you're shooting out the aerosol quite a ways, and that's going to be loaded with virus.
So let me ask you this. I stop into one of your pubs and I order a beer, and your waitress comes over and she's going to serve that beer and she coughs. She sneezes, she does whatever. You haven't required her to wear a mask in that business as per the governor's directive. She doesn't know she has COVID. I don't know she has COVID. All I know is she just sneezed on me. Isn't that an issue? Isn't that a potential issue no different than what you just talked about? Because you said the mouth has lots of bacteria, and in this case, the mouth would have COVID in it. So wouldn't you be putting me at risk?
Okay, so we have to ask ourselves, does the mouth have COVID in it? Because this is where it all comes down to, Joel. Who is infectious? First off, they have to have a viral load in their system in which the virus would be in their saliva to be aerosolized with a sneeze or a cough. We know that so many of the people that are positive don't have that viral load because of how we're running the test, and that gets into a whole discussion in and of itself. So that's where I say, if you have been exposed to someone who is symptomatically positive, you should wear a mask for at least those 5 days. If you're going to be around other people, you should isolate and see if you're going to get it within those 5 days. Because if you do get it for the 24 to 48 hours before becoming symptomatic, you have the possibility of shutting off the virus. These are real cases. That's a limited segment of the population. The vast majority are people who are not symptomatic. If they were exposed to someone, it was someone who was allegedly positive but never felt any symptoms and therefore was highly unlikely to have the disease at all, certainly not enough to transmit it. So we can eliminate 80% of this concern about who should be wearing masks if we just take a logical approach to who carries a virus load in their mouth, which would be symptomatic people.
So what are we out by wearing a mask? I mean, today I got in my pickup. I stopped at my local gas station. I wore my mask. I went in. I bought a Diet Pepsi. I come back and I hop in my pickup. I drive to Fargo. Before I go in, I put my mask back on. When I got into the radio studio, I took it. I mean, you can run that scenario in your head, but it sure didn't hurt me. It sure didn't bother me. I mean, what do you lose yourself by adhering to or having your employees adhere to what the governor said?
Well, the question is, the government should have a compelling reason to ask us to do something. And for us to say that we don't believe that it actually is going to accomplish what the government wants, but we're just going to do it anyway because on some hierarchy we feel like it's not that egregious or not that imposing. I mean, at what level do you say, well, wait a minute, now it does bother me? So it's simply a matter of giving up your personal choice for something that government is saying, which doesn't necessarily have a logical basis.
But doctor, we're the highest ranked state in the union. It's not working. Whatever we're doing isn't working. The number of deaths that we have versus what Manitoba has versus what Vermont has. When you look at the number of deaths, whatever we're doing is not working. And I'm sick of the argument that these people were vulnerable and this lady was 80 years old. She might have wanted to go to a kid's basketball game yet. And so explain to me then why what we're doing isn't working.
Exactly, Joel. I'm glad. Okay, so you're bringing this around to this concept of it's not working, we need to do something. But the question is, what is working? We have 49 other states that have done various restrictions, and the timing of their restrictions vary as well. We have that benefit because we are slow to getting COVID to say, oh, these states did these things, it's clear cut. When they enacted their restrictions and their mandates, it helped. But we don't have that data. You can, and it's available. I made a graph, it needs to be updated, but you can look at every state and plot out the most restrictive to the least restrictive states. And those that are most restrictive should have either the least, I forget the positivity, that screws it up, but would have the least incidence of death, the lowest death count per 100,000 or million, whatever you want to choose. And the least restrictive would have the highest. But Joel, it doesn't play out that way. It's completely randomized. What you have is a bimodal curve. You've got a curve that goes up and then it comes down and then it starts to come up again. The states that happen to implement a mandate and the timing just happened to be when it was starting to get to the peak, it looks like it had an effect. But then you look at other states, they implemented restrictions later, the curve is the same, or for the states that didn't implement any restrictions, the curve is the same.
Well, but doctor, we're the furthest apart. I mean, you go deer hunting out in Forbes, I mean, you go out there, you're a long ways from anybody, and yet they're still getting it in Dickey County. And so I have to ask you this. You know, you're sitting there running bars, restaurants, trying to provide a service and do what people do as an entrepreneur. We gave $16 million to the oil industry through the emergency money that came from the feds. I have a minute left. You do this same job so you know how tight the time is. Should we have ever given that $16 million out? And when I say we, that was a decision by Governor Burgum and the Emergency Council, or should have that money went to you and people like you who are trying to keep your businesses alive?
Well, I don't think the money should have necessarily gone to me, except for the fact, or you know, businesses, that money, except for the fact that the government is restricting us and closing us down. Then there should be some sort of compensation. If you had just let everyone go, then I'd say, you know, then it doesn't need to be done. I know what you're getting at with regard to oil, and Joel, unfortunately, I can't give you a very informed, honest answer. You know, that stuff, the way it is in Century Code, it's done with the budget committee, it's done with the governor. And
sure you can. Wait a second. I got to push back on that. You're a state representative that has never been afraid to challenge people in his own party, challenge people in my party. These decisions were made by government. And so when you say, I mean, would you have ever voted to give oil $16 million of those emergency funds?
This sounds political, Joel. It's not. The thing is, I didn't look at that stuff closely. I'll agree with you that it would have been nice if we could have gone into special session and done it according to the entire legislature, hashed it out, had the debate. I agree with you. I would like to have seen that take place. I did not look at the details. I don't know the details, and I can't give you an honest answer that I can stand behind with what exactly that money's for. I know it has something to do with plugging wells and this and that, but I don't know, Joe. But we'll agree that it would have been nice for the legislature as a whole to have a voice in that.
Doctor, representative, entrepreneur, thank you. Thanks for coming on.
Thanks, Joel.
When we come back, Chris Runge, attorney. She lives in D.C. but has family back in North Dakota. She lost her father to COVID. Let's visit with her right after this.
Bismarck Central, 4800.
4800, go ahead.
Requesting social services on-call team.
Stand by. 4800 Social Services requesting additional information.
You can advise social services that we have a 18-month-old female who was in a residence with a mother, now being transported to medical care for overdose.
Trusting your digital life to faceless tech giants can be risky. Will they keep your family and business information truly safe from prying eyes? If you subscribe to local Beck Lightband Internet service, you already have Beck Cloud Backup. Beck Cloud Backup is the safest, most private cloud storage for all your family memories, schoolwork, and business documents. Call 701-475-2361 to start using your free space on Beck Cloud Backup today.
You just might find the home of your dreams this weekend by watching the Alliance Real Estate Tour of Homes Sundays at 6 p.m. and Wednesdays at 7 on Beck, featuring properties from Bismarck, Mandan, Minot, and surrounding areas. The Alliance Real Estate Tour of Homes presents desirable properties that are for sale, lets you meet your Alliance realtors, and provides critical insights into local happenings from community and business leaders. Join us this Sunday evening at 6 or Wednesday at 7 for the Alliance Real Estate Tour of Homes on Beck.
Today's households have more digital devices than ever before. More links to family, business, education, and entertainment. Beck Communications spent over 10 years building North Dakota's fastest fiber optic internet service. Beck Lightband Internet, outpacing speeds in large cities nationwide. Lightband Internet handles all your digital needs without throttling your connection to the world. Beck Communications, valuable digital connections in rural North Dakota.
Howdy folks, it's the Caroline Cafe. I reckon it's time you're due for a hearty meal. So saddle up for the day with one of our Hey Bossin' breakfast homemade soups. Fill your grill at a salad bar, sink your teeth into our famous Caroline burger and barbecue ribs. Top it off with spoon rattling pie with a comb roll that's sure to put a smile on even the toughest outlaws. Shake the dirt off the boots each night and warm up with the gang. Tell them about it, Stacy.
I can't wait to see you at the county line.
Welcome back to Down the Road. Our next guest is Chris Runge. I've known Chris for years. Scary, smart, very, very dedicated. Headed off to D.C. on us when we would have loved to have kept her right here in North Dakota, so I still blame her for that a little bit. Chris is the director of the public employees at the American Federation of Teachers. So she knows what it's like to be in a room with a bunch of people that have to be in the room. She also knows what it's like to be locked up and call Washington, D.C. home. Chris, good to have you on with us.
Thanks, Joel. Good to be here.
You know, one of the reasons that I've been talking to you is because everyone knows that Washington, D.C. probably has comparable population to the whole state of North Dakota and is in a much smaller geographic area. So I want you to tell the people that share time with me here going down the road to that what did they do in D.C. and why do you think it worked?
Well, I think it's working. I mean, we're having a little spike, but I think it's working because they followed the science, first of all. That was most important, is they followed the science. They followed the recommendations of Dr. Fauci and their scientists and the Department of Health here in D.C., as well as in Maryland and Virginia doing some of that. But we knew early on that we didn't know all of the answers, and so we didn't know everything that could happen with this virus. And so they took strong action. We shut down around March 17th, March 23rd in there, and everybody came home and they shut everything down. And, basically just essential people were left to work. But everything shut down, including the metro, and in order to try and get a handle on this. So we did. We all came home. We stayed home. We, that's just what we had to do. And it worked. And now we're slowly opening up.
before you came on, I had a chance to visit with Dr. Rick Becker. The plastic surgeon, understands medicine clearly, or he wouldn't have the name doctor in front of him, or at least the doctor of medicine. And then you add in the fact that he's a state representative and a business owner. So he brings a lot of things together. And he said that it's a loss basically of personal liberty, that the science doesn't prove out that, look, by wearing a mask, you're going to keep the infectious rate down. I want to give you a chance to respond to that.
Well, I don't know how he can make that argument. It clearly worked in New York. It has clearly worked in other countries like New Zealand, South Korea. Australia has just reopened almost fully. Taiwan, of course, it is an entire strategy, a lot of different mitigation strategies that we have to do. I'm sorry, Dr. Becker, but he does not understand. He may be a doctor, but he is looking at it from a political standpoint and not from a public health standpoint. And I think that is the difference, is that we are looking at it here as the public health emergency that none of us have faced in over 100 years. None of us have gone through this. We don't know everything there is to know about this virus. It is not like the regular flu.
Explain to people what happened to your family here in North Dakota when it comes to COVID.
Yeah, so I've got lots of friends and family there. My father was in a nursing home for about a year and a half, and the lockdown came, and I got nothing but good things to say about this nursing home. They really did as good a job as they possibly could have, but he was lonely. Nobody could visit him, and he just decided it was his time, and he decided to go. And so I got out there, and we had the funeral out in Dickinson. He's buried there now, but almost 10 of my family members who went back to Washington, California, and Arizona came down, got COVID, and passed it to their significant others, and one was hospitalized, all because we attended our father's funeral in Dickinson. So, it's been an ordeal. They've gotten through it, but it didn't have to be this way. It didn't have to happen like this. This is not rocket science. This is not giving up your freedoms. I am not wearing a mask and thinking that I've given up any freedoms. I can't go into a store without my shirt and shoes on. This is no different. This is no different than that.
Well, I want to talk about that a little bit because your home state and the state that I'm living in as well as anybody. If I mentioned any town in this state, you could tell me what county that they're in. Right. I go out to deer camp. I go out to just buy some gas somewhere. Until the governor put down this mandate, if I was wearing a mask, and this isn't going to surprise you, but if I was wearing a mask, I was looked at somebody that just boats blew and caved in. And, why in the world would you be doing that? It's not that serious of a thing. The governor comes out and points out that North Dakota leads the nation in per capita in cases of COVID. And I wonder if that'll change people's attitude because, number one, you've told me time and time again that wearing a mask in D.C. is really no big deal. It's second nature now. Number two, North Dakota. Are we ever going to get it in North Dakota to be second nature?
I think if we keep talking about it and people keep doing it and we keep educating the public on it, I think you look at the numbers here, you look at the numbers in New York. In order to keep the schools open in New York City, the numbers have to be under 3%. They toddled very close to that number last week, but they're back under it again. So the schools are going to stay open because what we're seeing here is we do not want to go back to a total shutdown, which I don't think we would ever do. But North Dakota was never there. North Dakota never did a total shutdown. They just thought it was never going to happen to them. Everybody, when I would read things in North Dakota, they says, well, the hospitals are doing just fine. If the hospitals get overloaded, then we're going to have to do something. Well, now the hospitals are overloaded, and they still don't want to do something. They're still fighting wearing a damn mask.
Yeah. You represent teachers, ND United.
And public sector workers. Yep.
Exactly. And so they got to be there. right?
Yep.
When I drove up,
They never got to stay at home. They were always working.
Exactly. And when I drove up to Fargo today, there they were working. The roads were icy. They've got to be out and about and amongst people. So let me ask you this. North Dakota United did a survey. It's not going to surprise you. You've probably already seen it, where the teachers said, you know what? They don't feel safe. We've got to do better when it comes to protecting them in the schools. And yet they're still showing up. They're still doing their job. I want to know what teachers are saying to you nationally.
Oh, there's no doubt. I don't think the findings that the North Dakota United members did shows anything different than what we show nationally. Clearly, our teachers want to be back in the classroom. They don't like the online learning. Kids learn better when they're in school, but they also want to be safe. I mean, we know that our teaching force is an aging force along with our public sector workforce. And so we want to go back to work, but we have to do it safely. The economy can never open up fully until everybody is back in school, until parents can get their kids back into a safe daycare. It is just not going to work.
You know, I just have a couple of seconds left, but what's the perception of North Dakota? Over the weekend, I was asked to come on to NBC, and that was because the county sheriff said, you know what? We're not going to do what the governor tells us to do. So when you tell people you're from North Dakota, what do people think?
You get the eye roll. You get the, wow, it's really bad out there. You know, what are they doing? You know, and they're right. It's like, I don't know what they're doing. It's like, it's that very definition of insanity where you keep doing things over and over again, expecting a different result. We will not get a different result until they do all of the above in mitigation strategies.
Chris, always good talking to you. Thank you.
Great.
Appreciate it.
Take care.
When we come back, some comments on what the governor's executive order means, what it means to you, and what you should do about it right after this.
Bye.
He once won a spelling bee in an ancient language that he did not speak. He is the only man to ever earn extra credit on an IQ exam. His academic degrees are considered legitimate spending currency in 22 nations, 2 principalities, and at Chick-fil-A restaurants in the United States and Western Canada.
I do not always engage with education programming, but when I do, it is the Dr. Duke Show.
Stay educated with the Dr. Duke Show, weekdays at 4 p.m. on Beck News.
Introducing Accord Comfort Sleep Systems, a better way to sleep. We offer you 5 different models to give you the perfect choice of support and body comfort. Every model begins with our exclusive Accord Comfort Reflex Layer. This ensures proper spinal alignment and a deep down body relief. Our 8-inch Whisper Breeze provides a medium firm feel, and our 10-inch Gentle Night model has a quilted top, giving you a medium plush comfort. Both use Outlast fabric on the top of your mattress, ensuring that your body temperature is not too hot and not too cold. Our Copper Rest Sleep Series is our premier mattress, offering your choice of firm, plush, and luxury plush. Every model uses copper-infused gel latex and provides all the health benefits of copper. Accord Comfort mattresses are handcrafted in the USA and come with a 60-night sleep guarantee. You're going to love sleeping with us. Order today exclusively at accordsleep.com or Tom's Home Furnishings in beautiful downtown Harvey.
Capital City Restaurant Supply is your one-stop shop for quality restaurant products for the large to small kitchens. Commercial-grade restaurant and bar supplies, limb game processing equipment, refrigeration, dinnerware, and smallware. We sell everything including the kitchen sink for trusted manufacturers for the chef and all of us. Open to the public since 1971, we are veteran-owned and North Dakota proud. Let us take care of your restaurant and home kitchen needs today by visiting us at 1414 Interstate Loop in Bismarck or on the web at capitalcityrestaurantsupply.com.
My name is Rich Shook, and I lost my best friend in a grain bin accident.
Some of the emotional scars that when these incidences happen just resonates throughout the community like dropping a rock in a pond. I guess I'll never forget. At least the last moments we shared. That's why I think this is so important to get out there to people, is people think that it can't happen to you, and it can. The time it would take you to just kiss a loved one. and your life is over. I believe it's unacceptable.
This message provided by North Dakota Farmers Union.
You know, I know we were really COVID heavy during this edition of Down the Road, but we were bound to be, right? You had the governor of the state of North Dakota issue an executive order saying, you know what, if you don't adhere to these rules, you could be fined $1,000. He empowered law enforcement to do that. Certain law enforcement said they're not going to do that, all in western North Dakota. I might add, if you've got the sheriff in Hettinger County and Bowman County and Stark County, and they're saying, you know what, Governor, bite me. I'm not going to do it. That's a problem. That's a real problem. The governor maybe came late to this dance. But you know what? The band's still playing. It is. So welcome to the dance. Some would say it's because it's after the election, that the governor didn't want to be unpopular prior to the election because he knew he was going to win. But it's all about the percentage you win by in terms of being a Republican in the state of North Dakota. It's looked at. And it's a determination of how well you're doing as a politician. North Dakota is incredibly red. That being said, the governor also didn't want to tick off Donald Trump. But Donald Trump's going away. And so many people that believe that the reason the governor waited so long is he knew that Donald Trump wasn't going to be president. I'd like to think that the reason the governor did it was because he absorbed the science. That people around him said, Gov, this ain't going well. And I think it had a lot to do with the people that I mentioned earlier in this show, the hospital administrators and the president of those hospitals who said, you know what, we're being overwhelmed. North Dakota has to do something. Now, you heard from people who say, I'm never going to tell my employees or I'm never going to wear a mask myself. And then you heard from someone who said, you know, it's not that big a deal. And it helped our area. So you heard from both sides. So let me give you my side. Wear the mask. It's not that hard. Wear the mask. I do, unless I forget, in which case one of them is in my back pocket. And so you know what? I pull it out and I put it on. It's not that hard. It's not a statement of your politics or caving into the government. It's about slowing down a virus until that light at the end of the tunnel gets here. And that light is close. It's good riding with you, folks.